Secretary Azar, thank you very much for making time for us. We're talking about the plan by the Trump administration today to roll out a new health insurance plan here. The headline on it is that it's less coverage at a lower premium. Why are you going to offer this, and will it be better than the current Affordable Care Act plans?
So right now, the Affordable Care Act, we all recognize, is just not working for enough people. You know, in Wisconsin, through the end of the Obama administration, individual premiums for insurance in that market almost doubled, 93%. And more than half of the counties in Wisconsin have just one or two issuers, and that's just not choice. So President Trump ordered all of us to work to try to find more affordable and more individualized options for people to be able to secure health insurance. And so this is part of that. What we're proposing is to allow people to buy what are called short-term policies that would last for up to 12 months, and they would not have all of the regulations and mandates of the Obamacare individual market plans, and as a result, they could be much cheaper. So they could cost as low as a third of what the Obamacare plans cost. Back in 2016, that would have been about $124 a month versus $380 a month for an Affordable Care Act plan.
So should people be concerned about what this product will look like, because it will be somewhat of a limited coverage, and if you have pre-existing conditions, this product won't be for you?
Well, it'll be about choice and individualism here. So any person who will think about buying one of these plans will have to look at them very carefully to see if they meet their needs. We think probably people who are between jobs and have lost employer coverage in a transition, that might be attractive for them. For people who've been priced out of the Affordable Care Act individual market because the premiums have soared and they're not getting that taxpayer subsidy, could be an option for them. Or people who live in more rural areas where they have only one or two plans and they don't cover the physicians or hospitals near them, might be a good option for them. But folks should go in with their eyes open when these plans are available and see if they make the most sense for them. And it's really just about providing options and choice to people. You know, this doesn't change what's going on in the Affordable Care Act market. That's there. If that's the best thing for them, so be it. But it's choice for the 28 million folks who've been left out of that market, even though they were promised affordable care.
As you probably know, Democrats have quickly criticized this plan, calling it junk insurance. They say it's better to help people have more money to pay for these premiums, to try to provide subsidies for premiums. Would that be a better solution?
Well, that is Obamacare, is providing massive amounts of subsidy to buy people insurance. That's for the 10 million people in the individual market, who most of whom, 82% of whom, are getting taxpayer-funded subsidies to buy their insurance. That is exactly what you're talking about there. This is something that's primarily targeted at the folks who were left out in the cold by that, as the structure of Obamacare caused insurance premiums to soar, the healthy and young to flee that market because it was too expensive for them. And remember, we're talking about 6.7 million Americans are paying $3 billion of the individual mandate tax to avoid the privilege of not buying insurance that they do not want and cannot afford. 79% of those people are making $50,000 a year or less, and President Trump and Congress have freed them now of that tax starting in 2019. But they need an option. This is an option for them. Okay, for folks where the Affordable Care Act is working, that's there. But this is an option for the millions and millions of people where that's not working and isn't going to work for them.
Secretary Azar, before I let you go, I'd like to ask you about the flu this year. It's been an unrelenting flu season. As you know, the flu shot not as effective as people had hoped. Why can't we get this right? Why can't we come up with a flu vaccine that helps most people? And do you think it's time to put more money behind a universal flu vaccine?
So first, Charles, we're absolutely committed on developing a universal flu vaccine, but that's been something when I was at HHS in the 2000s we were working on. We're hopeful, but that's not just around the corner, but we're still investing much money in that research program. I would say for this year, we just released the data on the flu vaccine, and it still is effective for a lot of people. And our advice across the public health spectrum is, if you are 6 months of age or older, get the flu vaccine. We are still in the middle of this season. You get it. It is not too late. Even if it doesn't prevent you from getting the flu, it could lessen the severity and duration of the flu for you. It has proven effective in 59% of children. And of the children who tragically have died in this year's flu season, 75% of them were not vaccinated. So please, please, please get yourself, get your kids, get your parents vaccinated this year. It is not too late. And then take basic public health precautions of washing your hands, covering your mouth when your face when sneezing. If you do have flu-like symptoms, seek immediate medical attention because you may be able to take an antiviral that could lessen the severity and duration of your flu symptoms.
Secretary Azar, we appreciate your time.
Thanks, Charles.